Welcome to In Conversation with Ulash. I am Ulash Thakore-Dunlap, a therapist, teacher, parent, but someone who is a community member and really enjoys helping others to strive. In this short segment, I would discuss the importance of counselling and therapy. Growing up in London, England, we didn't have the money for therapy. Also, I come from an Indian family where there is a lot of stigma around talking about your problems and mental health. Counseling and therapy can be so helpful when you are feeling distressed and overwhelmed and you feel like you can't go to your friends and family at this time. Counselors and therapists are trained to listen to your needs and then explore how best to move forward to support you. Probably noticed that I've been using the terms counselling and therapy interchangeably. Counselling traditionally means short-term services, so that's when you go see someone for perhaps 5 to 8 sessions. Therapy tends to be long-term. That's when you're seeing somebody more than 5 to 8 sessions, ongoing. The goal of the counsellor or therapist is to meet you where you are in your life and to support you on where you want to go. It is important to find the right fit. So firstly, let's talk about how do you find a counsellor and therapist? There are many ways to find counsellors and therapists where you live. Firstly, you can ask your doctor or provider to give you a referral. You can go online and search for counsellors and therapists in your neighbourhood. Or there are numbers that can help you, such as in San Francisco where I live, there is a number called Access Line where you can dial it, and if you have Medi-Cal, it will help you navigate mental health services in your neighbourhood. In my experience, the best referrals come from friends, family, colleagues, school recommendations, or asking your doctor. Now let's go back to what I mean by a good fit. What I mean by that is finding somebody that you feel like you can connect and trust. If you're using your insurance, ask the counsellor or therapist how many sessions are covered and do you have to pay a copay. If you are using your insurance, ask the counsellor and your provider how many sessions are covered in your insurance. If there's a copay, what type of therapy is offered by the counsellor or therapist? Typically, when you're using your insurance, it tends to be short-term, usually 4 to 8 sessions. I say to my clients and people that are calling me that if you feel like we are not a good fit, then you can shop around and find a therapist or counsellor that you feel really comfortable talking to. Most counselling and therapy sessions are around 50 minutes long. If you're doing couples counselling and therapy, they tend to be a little longer, perhaps an hour and 10 minutes, an hour and 30 minutes. For family therapy, it tends to be longer, about an hour and a half. The first few counselling or therapy sessions, the therapist or counsellor will ask you a lot of questions and information about yourself. This is called an intake assessment. The assessment will help the counsellor and therapist learn more about you and how to best serve you. Typically, after a couple of sessions, the therapist and counsellor will come up with a treatment plan. A treatment plan is basically goals that you would like to work on with the therapist. I would say discuss with your counsellor and therapist how often you'd like to come and your budget and what you'd like to get out of counselling. Hope this short segment is helpful to you as you explore your options for counselling and therapy. Thank you for listening to this segment. If you want to contact me, you can go to my website at www.ulashdunlap.com. Thank you.